Welcome to your vital signs training. Knowing how to measure and interpret vital signs will give you a glimpse into your care recipient's health status. This plays a really big role in assessing your care recipient, preventing negative health outcomes, and ensuring their overall well-being. I'll teach you about the following 5 vital signs: blood pressure, heart rate, respiratory rate, temperature, and oxygen saturation. First, we have blood pressure. So blood pressure is the force of our blood when our heart pumps. A blood pressure reading includes a top number and a bottom number. There are 5 categories for blood pressure measurements. Normal blood pressure is less than 120 on the top and less than 80 for the bottom number. Elevated blood pressure is between 120 and 129 on the top and less than 80 on the bottom. High blood pressure, stage 1, is 130 to 139 for the top number, or 80 to 89 on the bottom number. High blood pressure, stage 2, is 140 or higher on the top, or 90 or higher on the bottom. It's an emergency when the top number is higher than 180 or the bottom number is higher than 120. So to measure blood pressure, you can use a digital monitor. So this is what a digital blood pressure monitor looks like. First, you want to ask your care recipient to sit back in their chair with their feet properly supported and flat on the floor. You want to place their arm on a table at heart level. So this is heart level here, and the table is about at her heart level. You'll ask them to turn their arm like this. You'll take the cuff, and the bottom of the cuff here, you want about 1 inch above their elbow. So about 2 finger widths for most people here. So you can measure before you put it on. We want the cuff, the bottom of the cuff, around here. So you can undo the cuff, put their arm through. Again, we want the cuff around the bottom here. And you're going to tighten the cuff, not too tight, but secure. So that feels tight, but not too tight. So most blood pressure machines will only have a start and a stop button. When you are ready and you have your cuff placed properly and you make sure that the care recipient is ready for their blood pressure to be taken, you press the start and you'll hear the cuff and see the cuff inflate. It's going to inflate, squeeze their arm tighter. It'll pause and it'll deflate and loosen again. At that point, when it has deflated, you will see the number on the screen, as I was saying before, the top number and the bottom number. If you notice that no measurement is displayed on the screen, you can check the placement of the cuff again and try and press the start button again. Do note that the person shouldn't be wearing long sleeves or sweaters. If someone was wearing a sweater like this, it could alter and give an incorrect reading. You want to make sure their feet are flat on the floor. If they have their legs crossed, it can actually make the blood pressure measurement come up higher than it actually is. So you want to be mindful of those 2 things. The second vital sign we're going to monitor is heart rate, which, if you're lucky, some of these blood pressure monitors actually measure the heart rate as well. So the heart rate is how many times our heart is beating per minute. A heart rate of 60 to 100 beats per minute is considered normal. Anything below 60 or above 100 should be spoken about with your doctor. So if your blood pressure machine doesn't measure heart rate, there is a way that we can measure heart rate without a machine. The best places to feel for heart rate include the inner wrist here, the inner elbow, and the neck. To measure heart rate, you want to use your index and middle fingertips to lightly apply pressure to any one of these areas. It might take a little practice and getting used to be able to feel the heart rate right away. If you can't feel their heartbeat on any of these places, try to alter where your fingers are to try and find it. And once you know the location that it's at, the next time will be easier. So as you're applying your fingers to one of these areas, you're going to look at a clock or use a timer and count the number of beats for 1 minute to measure and then record their heart rate. Take note to never use your thumb to measure someone's heart rate because you'll actually be feeling your own heartbeat too. The third vital sign is respiration rate. So this is the number of breaths that we take per minute. A normal adult's resting breath rate is between 12 to 20 breaths per minute. Below 12 or above 20 may be cause for concern. To measure your care recipient's respiration rate, we're simply going to watch their chest move up and down, and like heart rate, we're going to count for a minute. Keep note that if your care recipient takes strong pain medications, a low respiration rate could indicate pretty serious complications. Another tip, don't ever tell them when you're measuring their respiratory rate, because this can make people focus on their breathing and they can actually change their natural breathing patterns. So you can continue to listen to their heart rate for an extra minute, but actually be looking at their chest for the rising and falling without telling them. The next vital sign is body temperature. And our temperature can vary based on a lot of different things. If we just exercised, our temperature might be higher. If we drank a warm drink or ate some warm food, it might be higher. And even the time of day can alter our temperature. But the normal range for adults is 97.8 to 99 degrees Fahrenheit. Anything over 99 degrees Fahrenheit is considered a fever. The easiest and most common way to take temperature is by using a digital thermometer, such as this one. These can be used by placing it under the tongue, or in the armpit, or in the ear if you're using a special kind of thermometer. But for these types of thermometer, under the tongue or under the armpit is the best way. I'm going to demonstrate here so you can ask your care recipient to open their mouth and lift their tongue. You place it under their tongue and ask them to close. You will press the button on the thermometer, wait, and it will beep, and then a number will come up with their temperature. Alternatively, you can ask them to lift their arm, place it under their armpit, ideally without the shirt in the way. Again, press the button, the number will come up, and that's your temperature. Something to remember with temperature is that it can be an early sign of an infection anywhere in the body, and this is something to mention to your doctor. The last vital sign to address is oxygen saturation, and this represents the amount of oxygen in someone's blood. The normal range for oxygen saturation is 95 to 100%. However, some people with certain conditions may have a normal range from 92 to 100%. So be sure to confirm with your care recipient what their normal range is. If they are unsure, be sure to ask their doctor what you should be looking for. You can measure oxygen saturation using a pulse oximeter. It clips to their fingertip, and be sure that their finger is inserted all the way in. You press the button on the top, and it will read the amount of oxygen in their blood almost immediately. Remember that conditions such as poor circulation, heart disease, diabetes can all cause inaccurate oxygen readings. Nail polish on their fingertips can also interfere with the pulse oximeter and show inaccurate results. As a final note, be sure to document and report any concerns according to your agency established policies and procedures.